There, Tim Stoddart here. Thank you for watching this week's video. And today we are going to take a look at Cartwheel's latest Series A round of $20 million. So what is Cartwheel and what problem are they trying to solve? Let's take a look. So we're going to start off with a quick overview of a article that was published this morning on Hit Consultant. It's a website that I like to go to keep up with mental health and addiction treatment news. So you can see this at hitconsultant.net. I'll put the show notes in the video, and they made the announcement. So Cartwheel, a platform helping schools tackle the student mental health crisis by delivering affordable, evidence-based telehealth services with no wait list, raises $20 million in Series A funding, led by Menlo Ventures. Reach Capital joined the round, as did earlier investors General Catalyst, Box Group, and Able Partners. So I think this means that Menlo Ventures probably invested in the seed round, and then they opened up Series A to these other investors: Reach Capital, Catalyst, Box Group, and Able Partners. Okay, so let's just take a look at Cartwheel. This is the website. I don't understand this thingy that follows me around everywhere. Um, and this is their tagline: when it comes to mental health, students shouldn't have to wait in line. I agree. So I want to take a closer look at what is Cartwheel's real differentiating factor. I'm gonna get this out of the way a little bit. This is on the What We Do page of the cartwheelcare.org website. So I'm just going to read the three-tier factor directly from the website. Example of a tier 3 care experience with Cartwheel. We handle all logistics and keep your school mental health teams in the loop on student progress with parent/guardian consent. So it starts with a referral. A school or staff member submits a student referral to Cartwheel's care team. We reach out to the family within 2 days. After the referral, which is carried out by the school, by a professional at the school, I'm assuming a guidance counselor, there is an assessment. So within 7 days, a licensed clinician on our team conducts an assessment via telehealth and crafts a personalized care plan. We keep the school in the loop throughout the process. Finally, there is the actual care. There is the personalized care. Our team of licensed therapists provide evidence-based short-term therapy, typically 6 to 10 sessions. We also have child psychiatrists on our team to support medication management as needed. And then finally, there's ongoing care. Our team works with the student and family to assess longer-term needs and refer the community providers as needed. Okay, so I just want to talk a little bit more in depth about this business model. Obviously, I'm a fan of kids getting the help that they need. I'm sure everybody watching this video knows that there's like a real mental health problem. We can see it in the Google search trends, and we can also see it in really unfortunate statistics like the rise of teen suicide and the rise of teen cutting. Unfortunately, this data is highly correlated with the use of social media, so I think there's something to look at there. Nonetheless, in terms of the business model, I'm a little bit skeptical of it. I feel what is going to hold this business model back is the actual therapist. And this is the same thing that Talkspace has been struggling with, where they need so many in demand therapists, and the price that they can pay these therapists is much lower than what a therapist could typically make if he or she were able to open a private a private practice. Since it's telehealth, the insurance codes don't bill the same as they would if you actually visited a therapist or a psychiatrist or a psychologist at their place of business, at their place of practice. And so, because that, the cost per acquisition has to be so much lower. Now, I think what Cartwheel is doing really well is the cost per acquisition is going to be dependent on referrals. So, in a way, they can spend a lot of their marketing and their acquisition dollars building relationships with these schools. And obviously, there's plenty of schools across the country that are dealing with young kids and with youth and adolescents having mental health concerns. So I believe that they're going to be able to bring students in at an acquisition cost that makes it feasible. However, I still think they're going to really struggle with the therapist. Right here, our team of licensed therapists provides evidence-based short-term therapy, typically 6 to 10 sessions. We also have a child psychiatrist on our team to support medication management as needed. Yeah, this is going to get complicated. The retention rate for keeping therapists on staff is going to be very, very low. Therapists are going to join, especially ones that are like fresh out of college, right? That are newly certified. They're going to leverage the Cartwheel platform to start being able to treat patients and do the work that they love to do. But soon, and I think it's going to be sooner rather than later, these therapists are going to move on to maybe try to start their own private practice or get involved with a clinic where they can actually treat adolescents if that's who they love to treat, or whatever their specialized modality is, and they can treat their patients face to face. I think this is always going to be the problem with telehealth treatment and therapy services, but I'm excited to see how this differentiating factor with Cartwheel and their referral system really plays a role. That's it. I hope you liked this video. Please like, please subscribe, leave a comment if you have any thoughts on Cartwheel and their business model, and I'll talk to you next week. See ya.